This is Provident Island in Monrovia. This is where the very first slaves from the US started their lives as Liberians. And not far away from here is the Redemption Hospital, where the very first Ebola patient in Liberia was admitted and eventually lost her life. Doctors in this hospital, however, say bad days are gradually over.
We discovered that the most important thing is to break the chain of transmission. And if you apply the right infection prevention control by way of constant washing of hand with chlorine, covering yourself, you're able to avoid it. And with that in place, which we did and which we continue to proclaim and to profess to people, Ebola is a thing of the past.
Today, the hospital, in which more than 400 people have died due to Ebola, is currently admitting other patients, and the transit unit designated only for Ebola patients is empty. It was on 20 March 2015 that the very last known Ebola case of Liberia was admitted to this transit unit. The patient was a lady. She died almost immediately, just like any other person who was admitted to this transit unit. There were many sad stories to tell, but now this is an empty place until perhaps the next patient is found. The hope is that will never happen again.
It was actually a terrible year because even with medical supplies, it was actually difficult. Even having gloves, it was difficult. But at least after the Ebola situation, with the help of AU, we have things ongoing, and at least we are working on a smooth atmosphere.
These medical professionals lost 10 of their colleagues while on duty to Ebola.
Good morning, welcome to Channel 6 News on Sky TV. My name is Alice May Wellington. Let's bring you our first developments.
This is Sky TV, one of the 6 privately owned television stations in Liberia. As you can see, the studio, old, not very much equipped, but these are the small broadcasters the government of Liberia and the Continental Response used to educate Liberians to halt the spread of the killer disease. Few Liberian journalists lost their lives when covering the epidemic, but it was worth the sacrifice, says this newscaster.
There were times we went into ETUs, like that of the one we had at Redemption, to air, not stigmatizing, but telling people what this virus does to an individual if you're affected. So it behooves us as citizens and as media practitioners to ensure that these messages were sent. And this is something that helped today, that gave Liberians the courage not to keep sick people. We had to strategize as media practitioners to ensure that we sensitize, but still we were also observant of the virus, despite few of our colleagues coming down, which is very sad.
The damage caused by the Ebola outbreak is partly assisted by the already weak health system here. Everyone inside this city tells you Liberia has learned its lessons in a hard way. Girum, Chala, CCTV, Monrovia.